I work at the Camp Institute, which is a privately funded neuroscience institute in Sarasota, part-time. At the University of Central Florida, I do clinics. I run my own practice. And so I'm at different places, but I've always been very much a clinician at the coalface. So I'm going to be telling you some very interesting stories. And what some of the speakers spoke about yesterday, we need more case reports about how well the ketogenic or the low-carb diet performs. And I have many, many dozens of what I call my centenarians, i.e., that on the advice given, they have lost 100 pounds or more within months and sometimes as much as a year. And there's many such cases, and they improve dramatically. Now, I spent many years working at the Veterans Affairs Hospital, both in Tampa and in Orlando. And there you see particularly interesting scenarios because the military people have been exposed to things that most of us are not. And they also have much more intensive traumatic brain injuries, spinal injuries. I've seen many people with plus 500 paratrooper jumps with 200 pounds on their back. You can imagine what their spines look like. And even worse, what they complain of, severe refractory pain. And sometimes we just have 10, 15 minutes to tell them what to do. They say, "Doc, what do you do for me?" And you have to come up with something. And the same happens in the stroke world. I trained as a stroke neurologist many years ago in the 1990s at Columbia University. And even then, the carotid artery surgery of the neck, some people have a blockage in the artery or a stenosis, a narrowing, and that causes stroke. And the vascular surgeons at that time had been repairing these arteries, unblocking them surgically for 30 years. And the neurologists, that's my group, would say, "Well, we don't really know if this works. First, do no harm. How do you know we're not harming you?" Well, they were right and we were wrong. And we're in the same situation today with the low-carb/ketogenic diet in that we're proposing it to people as a clinician. And we have a lot of scientific evidence from you basic scientists that it probably will work very, very well. And we are accumulating case reports and even randomized controlled trials. So that's what I'm going to be speaking on. And the first point I want to make is we cannot possibly differentiate the mind and the brain. It's one and the same thing. And psychiatry and neurology should be all the same thing. There was this Cartesian divide between us, unfortunately, but we are all brain specialists. And we see these disorders, whether neurological or psychiatric, and they have a strong interrelationship with each other. And then, of course, the body and mind and brain cannot be separated either. If you have an unhealthy body, you will have an unhealthy mind. The bigger your belly becomes, the smaller your brain becomes. There's a direct relationship. That's been shown clinically. We also know that anti-inflammatory diet, nutrition influences not only the body, but mental outlook and mental symptoms and neurological symptoms. And before you get the tip of the iceberg, i.e. the psychiatric or neurological diseases, you can have impaired outlook and perspectives. You can have these subtle behavioral abnormalities that often escape clinical detection, but they cause a lot of trouble in society. I'll give you a very good example. This book, Brain on Fire, also a very good movie, details the story of a young girl who was committed to a psychiatric ward because of seizures and bipolar disease, schizophrenia. Some of you may have seen it. I strongly recommend you review this. It just shows you how clinicians like myself in neurology and psychiatry can miss these diagnoses completely. And that's exactly what happened. Multiple neuroscientific clinicians, if you like, missed the whole diagnosis until they stumbled upon one who took a special interest. And that's something we have to do as clinicians, no matter what kind of clinician you are. Take a special interest in your patients. I'm at a stage in my life when I can scale back a bit. I retired fully from my permanent job, but now I do 6 part-time jobs and I'm much busier. But at least I can determine how much time I spend with people. And I spend between an hour and a half with new patients. That's the minimum. If you don't, you're likely to miss things. And believe me, I miss things too. But in any case, she stumbled on the right clinician who took his time. He figured out that she had autoimmune encephalitis. It was treated, and she returned back to complete normality. True story. And it doesn't only apply to this disease, it can involve many other diseases. Now, there's going to be a little bit of overlap because I'm one of the last speakers of the conference. So I'm going to apologize for if there's any overlap, but I'll gloss over it. I think some of you all know these statistics, but if you look at that world obesity map from 2014, the red-colored countries are the ones that have obesity, i.e. basal metabolic index of more than 30. And that's the men on top, women on the bottom, and these are frightening pictures, aren't they? We also know that the number will be 1 billion by 2030. And I will draw your attention to the fact that mental health, if you include substance abuse, which is also mental health abnormalities, also number 1 billion. So that's a very interesting association. 1 billion each. Is there a relationship? Absolutely, and we'll see that. A very influential paper in JAMA Medicine, Journal of American Medical Association, 2018, depicted dietary risk factors as being number one of the 17 leading risk factors for mortality. That's what the conference is all about, dietary risk. I think you're all familiar with the Banting diet and William Harvey, who treated his patient, William Banting, who then subsequently published his book, Letter on Corpulence, in 1862. But fast forward to just, I think, a few weeks ago now, when Christopher Palmer published his book on brain energy, Harvard psychiatrist. Is anybody familiar with this book? Yeah? Yeah, what a book it was. And he treated his bipolar schizophrenic patient who was refractory to 17 different medications successfully with a ketogenic diet. And as with many of us, one patient that I saw once changed my whole career. This one changed his whole career. I was trained as a stroke neurologist until I stumbled upon a young black man in Africa who imitated everything I did in front of him. If I clapped my hand, he would clap his hands. If I pretended to fly like a bird, he would do the same thing. If I coughed, he would cough. It's called imitation behavior, and it's a stroke lesion of the mirror neuron circuitry in the brain. Very interesting condition. And that changed my whole trajectory to becoming a cognitive neurologist. And my mentor in New York said, why this? I'm training as a stroke guy. I said, because all strokes have cognitive impairment. And since then, I've learned that all neurological and neuropsychiatric disorders, of course, have cognitive impairment to a greater or lesser degree as well. I coined this term clinical simultanagnosia, not to be fancy, it just means piecemeal vision. You know, when people like yourselves or many of you go to the doctor and you say you have ringing in the ears, the doctor says, yeah, you got tinnitus. I said, oh, and they tell their family, you know what, I have tinnitus. It's the same as ringing in the ears. So you speak English and we speak Latin and Greek back to you. That's how we earn money. But this is an interesting condition. It occurs with strokes and with young women with eclampsia, for example. They cannot see the big picture. They only see items. So if you look at a car, for example, they'll see the tire, a window, a rearview mirror, and they cannot tell you this is a car because they have piecemeal vision, but they have excellent detailed visual acuity. So this is something that I think is happening in clinical medicine today. For example, if you look at dopamine is central to all the neuropsychiatric conditions, except for things like depression and anxiety. But all the others are dopamine abnormalities. Metabolic syndrome, the same thing. you have hypertension, diabetes, elevated triglycerides, etc. And you have a metabolic failure in the body, and it manifests with a whole host of different organ failures. In fact, every organ in the body fails if you're obese to a great lesser extent. We see this too with dementias. There's at least 7 major dementia syndromes. All of them have as their initial insult a cerebrovascular failure. Used to be just vascular dementia, but now we see that Alzheimer's has just as much vascular disease. In fact, all those little white spots that we were shown by the radiologist in the brain, they were called consistent with normal aging. Not so. They're all abnormal. And those are the first many scars of cerebrovascular disease in the brain. I've also come across it with Gulf War illness syndrome. Back in the 1990s, the first Gulf War, there was a great concern with nerve gas poisoning. So the troops were pre-treated with pyridostigmine bromine tablets, as well as permethrin insecticide in their Kevlar vests. So unfortunately, that combination caused mitochondrial toxicity. So there's a specific lipid molecule in the mitochondria. And the Roskamp Institute was one of the first groups that was able to delineate this in mice. They gave mice Gulf War illness, and then they were able to cure them. And they're now doing the same for the troops. So these soldiers presented with a myriad of disturbances. They got mild cognitive impairment, they got migraines, they got muscle pains, they had fatigue. It was called chronic fatigue syndrome. They had GI upset, chronic diarrhea. They had skin rashes, wheezing in the chest. So they went to 10 different specialists. Yeah, you got skin rash, you got migraine, you got irritable bowel syndrome. But it took 30 years to put it together, one cause. Now we know. So this is what I call clinical simultaneous nausea. It applies to many of our conditions that challenge us today. So this is going to be slightly repetitive, so I won't keep it up for long, but even the groups that study the ketogenic diets, they're not totally in agreement with the percentages, I've noticed, but it doesn't really matter. And then there's at least 7 different kinds of low-carb diets or ketogenic variants. And I think most of you should be familiar with this by now. They each have different advantages, and I'll show you later that there's already some clinical trials that show that, for example, a modified Atkins diet is about as good as a ketogenic diet for certain conditions and so forth. And again, this is going to be some repetition, but it's useful to know that the basic scientists, like Dominic's talk, which we just had, are giving us the background information so that we can give people in front of us the right advice. I would recommend you follow this. This is the science behind it. This is very important. Now, I'm sure you all know these 11 different mechanisms by now. Off by heart, do you? Well, we can't remember things more than 5 items, by the way, and we do best with 3. So anyway, it's useful to remind us that there's multiple different mechanisms. And you'll see that neuroinflammation, antioxidant capability, cerebral excitability, these are really key things. Increase of brain-derived neurotrophic factor, the potassium channel activation, clearing amyloid beta and tau. These are so critical to so many neurological and neuropsychiatric conditions. So I mentioned to you that there's a strange concurrence of 1 billion people that are going to be obese very shortly, and 1 billion people that have neuropsychiatric disease. Doesn't this say something? I think it does. And we know that there's this bidirectional relationship between all these disorders. And there's a new piece of information that has been known now for a few years, that there's a lot of comorbidity with neuropsychiatric disorders. If you have, say, autism, you may have some schizophrenia, you may have some bipolar disorder, you may have some depression, some anxiety. And on the other side, clinicians have known for a long time that if you treat depression, You also have to treat anxiety. They seem to have both. And the one drug kind of treats both, at least to a small degree. So we really should be looking at these mental/neurological disorders as not so much disorders, but as brain energy failure syndromes. One cause. And perhaps the low carbohydrate ketosis diet is the solution. So it's a problem with the powerhouse, and with the brain having up to 2 million mitochondria, specific neurons having up to 2 million mitochondria. And here I'm subject to being corrected by our basic neuroscientists. This is what I've read in the literature. I read that some cells can have many thousands or even tens of thousands of mitochondria, and that some neurons have up to 2 million. So I stand to be corrected. But in any case, it's a huge number. So with neurons being the most active cells, they're the ones that will fail first. There's another interesting condition. Mitochondria and bacteria have very much a shared tradition. And this is important because the mitochondria release molecules, small pieces of DNA, and these can be recognized by our immune system. And they can be the missing link with triggering inflammation. And mitochondria are critical to us because if they are dysfunctional, less ATP gets used, and we have less energy. And of course, this low-level DNA change and the fact that they're able to respond to environmental changes so much more rapidly than our cells, allows them to make the changes, and so that we can adapt to the environment. And Darwin said that it's not so much genetics, but the conditions of existence, and he was talking about epigenetics. So our environment changes us all the time. Not so much the genetics. That takes 20,000 years. If you want to change from black to white or white to black, from skin color, for example, it takes 20,000 years moving either from the tropics to the temperate climates. Simple as that. So again, a little bit of repetition, but notice the similarity of the mechanisms of mitochondria and what the ketogenic diet did. There's a huge overlap here. The mechanisms of the ketogenic diet and what the mitochondria are able to do, there's a huge amount of overlap. So are we coming up with new mechanisms? Well, Dominic in his previous talk gave us a lot of very, very impressive neuroscientific experiments, which were absolutely marvelous. Thank you for that. Unfortunately, on the clinical side, we do have some, but not many. But already there's many reviews, and there's a few randomized controlled trials, and some very interesting retrospective trials, and a lot of very much plausible mechanisms under each of these diseases that have been studied. Epilepsy is the first one. Migraine is important. Alzheimer's, depression, Parkinson's disease. There are a number of studies of these and other neurological disorders. And I'll go through some of those. Now, the complex nature of neural diseases makes the treatment that we give people today relatively ineffective. For example, you'll hear that the 21 million people in the United States with depression, 90% are not responsive to medication. That's a huge number. And you'll see that the new treatments like low-carb diet, ketogenic diet, and others that I'll discuss, they have multiple mechanisms of action. That's very useful because it's more likely for these devices and diets rather, to heal the underlying process, not just to treat symptoms. Now, this is something worth looking at. If you look at the dozen risk factors for stroke, for example, they're almost the same as the dozen risk factors for Alzheimer's disease. In fact, it is only a year ago that traumatic brain injury was added to the list of stroke risk factors. It's been with dementia and Alzheimer's disease for a while. Hearing impairment is a relatively new one that was included. And this is also a recent inclusion. But there's an 80 to 90% overlap. And then, of course, they're very interesting statistics, and I've given you the references below over here, that if you modify 12 risk factors for dementia, you can reduce this by 40%. This is a massive number. There's 10 risk factors that are associated with 90% of stroke risk. This is hugely important information, because we can do something about these diseases. And if we remind ourselves that all dementias have an underlying cerebrovascular pathology, we can reverse that. And there are books like, for example, Dave Bredesen, who's written extensively about reversing Alzheimer's disease, and he first published a whole series of cases where people had at least moderately advanced Alzheimer's, were sitting at home doing nothing, and he got them back to work. And he's not the only one. So there's been a major shift in our understanding of what dementia is all about, and it's not a do or die diagnosis anymore. It's an opportunity to intervene, to figure out what is the underlying cause. Anybody can diagnose a stroke in the street. Left-sided or right-sided weakness, speech impairment, sudden onset, yeah, probably got a stroke. And that's easy. Even localizing the lesion in the brain is no longer important to us, because they will immediately have a brain scan which can depict that lesion to the size of 1 millimeter within minutes. What's the most important thing? Underlying cause. What's caused the stroke? Until you get that right, you cannot prevent the next one. So to figure out what the underlying causes is absolutely critical. Remember, we said that the brain, being the most active organ of all, is probably going to fail first when there's an energy supply failure. And probably the most common manifestation of that, and I think many of you get this, is migraine. And migraine was, for a long time, considered kind of a psychiatric diagnosis. Better pull yourself together, you're putting it on, unfortunately. But it's the earliest sign of brain failure. And it actually has survival advantages. Have you ever heard of the saying that some migraineurs, if you have migraine, you're supposed to have a slightly more intelligent brain? You ever heard that? Yeah, we've heard it. What that really means is that you have an early warning system that something is going wrong. It's like a red light going off on your dashboard. You better pay attention to it. Now, of course, I belong to the physicians that just treat symptoms. Not anymore, but that's how we were brought up. Yeah, if you got pain, treat the pain, get out of my office. Got depression, here's a pill, out. That's the approach, unfortunately. And even today, just in the last year, there's been 6 new anti-migraine drugs that will treat the symptoms. A little bit better than the past, but it's still not dramatic. They work, but not dramatic. But why not think about, why have a migraine in the first place? You know that migraine patients have an increased cerebral reactivity to every sensory symptom. So you have photophonia, photophonophobia, osmophobia, haptophobia, all the phobias. And what happens is that you feel so bad that you have to lie in a dark room, the curtains closed, and then within hours, a lot of people will improve. So the brain has said, there's something wrong, you're running out of energy, please go and rest. There's also the spreading depression, cortical excitability that occurs with migraine that can cause all sorts of things like visual hallucinations, and can even cause transient weakness or numbness of a side, and then you have the big anxiety, is this a stroke or not? And yes, there's a relationship between stroke and migraine. It's small, but it's there. But have a look at this up here. See all these little pictures? These are different organ systems. If you have a migraine, you have an extensive comorbidity with many, many other organ systems. You can have depression, you can have GI upset, you can have epilepsy, you can have vascular conditions such as stroke, etc. So again, there's this pan-clinical syndrome involving many organ systems. Is there a single unifying underlying cause? Yet again, yes, energy failure. And this is this is what neurologists do to you people. They give you these fancy diagrams and make it very complicated. You have this thalamocortical dysexcitability, and that gives you a pro-inflammatory state, and the trigeminal vascular system gets involved, and that causes the pain. And you know what? We have a drug for that pain. Patient's very happy. Okay, great. But really, the message is treat your brain failure. And the most common cause of migraine is what, for example? Does anybody know? Number one cause. And the number two are what? That's the biochemistry. But in the environment, what's causing it? Stress. Psychological stress, yes. And the second one? Weather change. Weather change is a stress on the body. I think, Dominic, you referred to environmental pollution, for example, being a problem with many diseases. Well, when there's a weather change, that atmospheric barometric pressure is a potential stressor on the brain. And at least from epidemiological studies, weather change is at least one of the top 3 causes of migraine. So we've just had weather changes in the last 2 days. So I hope some of you don't have the migraines. But in any case, neuropsychological stress is the number one cause, for sure. And you'll see why, because we are a very stressed society, it's particularly now. I enjoyed the talk very much about the metaverse yesterday. I mean, we're more stressed than ever because of what's happening in our lives. Now, are there clinical trials that help us? Absolutely. The migraine treatment with ketogenic diet has an open-label, single-arm clinical trial that had some very positive outcomes, and a retrospective observational study, which is also positive. So there's burgeoning evidence now. Yes, these work. They seem to absolutely work. And of course, the mechanisms that you know about have been consistent with the pathophysiology of migraine, which I showed you earlier. And what's really happening is that we have these extensive neural circuits in the brain. The most important one is the default mode network, the central executive, and the salient network. And these are responsible for our higher cortical functions. And they all become deranged in migraine. Now, when we do the right test, we can see the problem in the brain. Most people with psychiatric diseases, for example, have normal MRI scans, including migraineurs. If you do the right kind of imaging, you'll see the abnormality. So we have new tools to figure this out, which is great news. And this is what I want to emphasize, is that the most sensitive part of the human brain is the prefrontal cortex. It's the Achilles heel. And if you are stressed, like neuropsychological stress, this is the first part of the brain that runs out of energy. And one of the many things it'll do, it'll give you a migraine if you have that early warning light. And you can, now this is the important thing. You remember the impaired outlook perspectives that may happen to your brain? You may become a raging lunatic sometimes if you have a migraine. That's exaggerated. But you can behave very poorly. People can have the most amazing upset in the hours before a migraine. And you can switch from a reflective state, thinking about things rashly, to a reflexive one. You might say things to your colleagues and friends that you would not otherwise do. And of course, in our current information age, which we also heard about yesterday, we are particularly stressed. We have to depend on this prefrontal cortex all the time. And we're stressing it out, running out of glucose and energy. And yes, you get a migraine. So here's the evidence. If you have migraine, you can actually have frontal lobe dysfunction, and this has been studied, especially dorsolateral and orbitofrontal. Orbitofrontal cortex is the part of the frontal cortex that allows you to inhibit a response. You know, instead of flying off at the handle, you'll rather say nothing. Somebody cuts you off in the traffic, you don't become a road rage victim. So the most important thing that happened in the evolution of our brain is to actually inhibit a response. You might know the story of being charged by a lion if you're in that kind of scenario. My son was. And we sent him to Africa for 3 months to live in the bush, and he went on this wilderness leadership course, and their group was charged by a lion. There were actually a bunch of lionesses, and the game guard says, if one of you moves, you will be food. And of course, they just had to freeze, and the lions charged them and stopped and walked away. So if you don't inhibit a response, you could become somebody's dinner, for sure. Now, again, this has been taught to you. The ketogenic diet was the go-to treatment for seizures. Then, of course, pharmaceuticals came along. And most neurologists, including epileptologists, have completely forgotten about it. Even to this day, every year there's more and more drugs that come to the market. They know about those. They speak about them. They get paid handsomely by the companies to speak to them, to their colleagues. And so the whole thing goes on. The guidelines in medicine are often written by pharmaceutical company-paid clinicians. I know I used to do it for a short period of time. I know the game. That's why when I started several stroke centers in this country, we had and I had to follow guidelines, and one of them was to lower cholesterol. And the NCEP 2018 revision is a 284-page document on how to lower cholesterol in stroke patients, which you don't want to do anyway. I've never come across a doctor who's read it. Anyway, so Dominic already discussed most of this. I just wanted to point out that the modified Atkins diet seems to be more advantageous because people tolerate it better. But this is a typical seizure as we see on an EEG. And today the tide is turning because consensus statements now incorporated as part of the treatment for refractory seizures. And this is just hot off the press, was published just last week, that the modified Atkins diet versus standard therapy was significant. It's not published yet, but I got this accepted publication. What about Egyptian diets? We know from the Horus study that Egyptians had a lot of calcification in their coronary arteries, their carotid arteries, and this was accomplished by scanning mummies. And they, of course, had a high grain-based diet. And today there's no real studies, clinical trials yet in cerebrovascular disease, but there's a lot of supportive evidence from basic scientists because, for example, you can block the caspase protein and also inflammasomes. And remember that cerebrovascular disease can present in many different ways, with hemorrhage, with subarachnoid hemorrhage, with white matter lesions, with microhemorrhages, and so forth. So there's many ways that the vascular system can fail the brain. And I mentioned this already, that the ground zero of all major cerebrovascular disease, of all dementias, is cerebrovascular disease. And here's the supporting paper, right? And really what it is all about is the cerebrovascular unit over here. And this is a good example of extensive white matter disease in the brain due to vascular disease. This person could be clinically normal, but it's teetering on the edge. And if you look at reviews for cardiovascular, cerebrovascular disease, there's a lot of evidence already, and the ketogenic diet actually will rectify almost every one of the problems that we see with metabolic syndrome and vascular disease. So I anticipate the clinical trials when they come about are going to be very successful. We've known for a long time that multiple sclerosis is an autoimmune inflammatory disorder, and of course the ketogenic diet is going to hopefully treat this remarkably well. There's already a positive pilot study, and people with MS get increasingly more toxic medications. And they're the ones who say, is there not another way? Well, there will be. We know that insulin and obesity and Alzheimer's is related. In fact, Alzheimer's is caused a type 3 diabetes. And already in mild cognitive impairment, which is the area that you want to intervene, not when somebody's demented, a blinded randomized controlled trial of a ketogenic medium triglyceride diet was positive and improved people's cognitive function in trail making test, verbal fluency and naming, with cerebral metabolic rates increasing with the ketogenic diet. And remember that we have a lot of evidence from randomized controlled trials that if diet becomes an intervention, in addition to other things like exercise, there's a dramatic improvement. You can reverse cognitive decline. The finger trial is now gone multinational. With traumatic brain injury, you have a sudden onset of neurotransmitter release and then low glucose and decreased cerebral blood flow. And if you treat these people with glucose, you can exacerbate because their glucose is low. We treat with glucose, but you can make things worse. And there's a trial back in 1991 that if you give them ketones, you will improve them. So we anticipate more trials in this area too. And then this was a very important trial from Georgia Edie's group that severe refractory mental illness is improved if you give a ketogenic diet. In fact, the number of medications is dramatically reduced. So this is a great clinical study with a very important message. And the same is with depression. There are many trials that if you follow an anti-inflammatory diet, you have success. And meta-analyses. So I wanted to talk with the last few slides about how did we get into this mess? What was our ancestral diet? Well, 50 million years ago, the whole earth was subtropical and we ate mostly fruit. And we lived in this kind of three-dimensional environment. And then Silicon Valley 1 was the African Rift Valley about 2 to 3 million years ago, where we started eating a fish and meat diet. And then after that, from about 200,000 years, an interesting thing happened. We had a high seafood and fish diet, first in southern Africa, and then we found evidence in other river valleys in Europe predominantly of marked sudden innovation. And this caused the enhanced working memory. So our brain was super connected all of a sudden. And of course, now we have smaller heads, unhealthy body and brains. So why did this happen? Well, we were designed to have a shore-based diet, whether it was in the ocean or in rivers or lakes. And that gave us the optimal brain-specific nutrients, which are these down here: DHA, AA, iodine, iron, copper, zinc, and selenium. You can only get this diet from seafood and eggs, not savanna meat. And Mark Verhagen from Belgium is a great advocate of this. And he proposed that we did this in 3 stages. We first jumped down from the trees into the water, nearby water, and only much later did we forage onto the savanna. But this sudden increase in a high brain-specific nutrient diet seemed to boost our brain size and connectivity. And there was a period between 20 and 5 million years ago that there was a missing link. And this is when the apes in Europe started living between trees and water. And there's also an aquatic ape hypothesis, which proposes that we spend a considerable time in water, swimming, etc. So these are all there's a lot of support for this now, but not always well known. So this is what's happened in the last 7 million years. We used to have super brains, probably about 10,000 years ago with farming. And there's been brains found that were 2,000 cc in volume. And our brains today are average 1,300 cc. And this is a good example of an atrophied prefrontal cortex from frontotemporal dementia, which is one of the most common dementias we see today. So we are dealing with a problem like this because our brain size is plummeting and our connectivity is becoming impaired. So these are absolutely key. brain-specific nutrients. Now, Herman Ponzer from Duke University has done a lot of great research on the metabolic requirements of people, and he found that the energy consumption, total energy expenditure of humans is much, much more than of the great apes. And he also found that the Hadza, which he studies in Tanzania, and Western people consume about the same amount of energy per day. Now, why is there this big difference? It seems to be that when you exercise, you don't expend that much energy. But for the other 24 hours that people are living, their brain consumes 25% of the total energy. So it's our energy-hungry brain that is dominating this. And we know, too, that the brain networks have these high connectivity hubs that consume this energy. And these are the hubs that fail, for example, in migraine. So we are gas guzzlers, we have bigger tanks, so we've got more stores, fat deposits, for example, and we rev at a much, much higher rate than the great apes. And we also know that whether you look at pastoralists, agriculturalists, or foragers, they all have normal body mass indexes, except if you have a Western type diet. Your body mass index goes sky high. Now, there's a psychopathology P factor that has recently dawned on psychiatrists, that there seemed to be this tremendous connection between all the psychiatric diseases. If you have autism, you have this, and you have that, and you have another thing. Are we missing this? Is this all due to the brain energy failure? If you have one illness, even with migraine, you have a comorbidity with others. And this is a great paper from Nature delineating the different psychiatric disorders and how they're all interrelated. And there's studies involving 6 million people saying that if you have one mental disorder, you have an odds ratio of 2 to 30 to have others. So what is this P factor? We also know that the treatment for depression and psychiatric disorders today, they're not really working out well at all. Is it the microbiome? I won't go into this now because we've been told about this, but I do want to draw your attention to this, that vagus nerve stimulation was the first thing that was used to treat refractory epilepsy. That was 30 years ago. Today we have non-invasive vagal nerve stimulation over here to the neck, 4 minutes a shot, and it is now FDA approved for 9 different headache disorders, cognition, the Air Force is studying it intensively, obesity, COVID-19, hippocampal neurogenesis, depression, and it's about to be approved for PTSD. Very interesting. Same kind of thing with a ketogenic diet. It works on the same mechanisms. Here are the mechanisms. There's very much a 60 to 80% overlap with the ketogenic diet or the low-carb diet for that matter. Now we have a problem. Information is increasing at an alarming rate. And us clinicians are bound to keep up with our information and medicine, which is a daunting task because you know how much there is. And we can get sued if you miss this and you didn't know this fact about medicine, you can get sued. So there's that side to it. And it does happen, but unfortunately not that much. But look what's happening now. Clinical medicine knowledge in the 1980s doubled every 3.5 years, and in 2020 doubled every 73 days. We have another problem, reliability of data. I found this poster up in the American Museum of History in DC. Thought I'd take a picture and use it in my slides. This goes back to the 60s and 70s. So this is what we were told. More doctors smoke camels. And this is a very, very nice book. I'm sure Nina Teicholz might like it if you don't know about it already. I'm sure you do. But editor-in-chief of the New England Journal of Medicine said up to 70% of trials reported in the New England Journal of Medicine are false. How about that? All right, I'm almost done. The mitochondrial epigenome and environment interaction. So this is very critical. The mitochondria can mutate so much more rapidly than our own DNA in our cells, and therefore is rapidly responsive to the environment. So this connection is vitally important because it allows us to respond to a changing environment, whether that's physical or something that has to do with our brains or other brains. And final slide is Wallace, who is a very, very clever researcher he's now at UPenn. He claimed back in 2017 that all psychiatric disease is due to mitochondrial failure. Metabolism connects all the dots. If you fix that, we can fix these diseases. We know how to fix metabolism: diet, sleep, light, exercise. And I devised these 5 brain fitness rules that I give to people. And if we can use this, we have a prescription, a new precision medicine approach. And this quote from this poet is particularly relevant in our discussion. When a flower doesn't bloom, you fix the environment in which it grows, not the flower. And this final slide is to remind us that we all descended 200,000 years ago from a single mother called the mitochondrial Eve in southern Africa. And so we are all related. And thanks to the mitochondria, we were able to trace that. Thank you very much for listening.
Thank you for your presentation, Dr. Hoffman. I'm in the back asking you questions from the table back here. Thank you very much. Larry Spears has a question for you on the online questions here. Dr. Hoffman, please comment on the impact of a ketogenic diet and exogenous ketones on ADHD, please.
It sounds promising. I didn't come across any specific studies yet. But if you look at the mechanisms, and there's quite a few studies on not ketogenic diet, but DHA-based diets and treating autism and ADHD successfully, but they're pilot studies.
Okay, thank you. A. Schaefer has a question. Can you comment on challenges of treating people with migraines with ketogenic diet when the keto flu exacerbates migraines acutely, even when taking mitigation measures such as pushing fluid and electrolytes?
We don't know. I found only two decent studies that looked at migraine. They were both positive, and that in relation to other recommended treatments hasn't been looked at. There's emergency treatment of migraines in the ER, for example, where you're given intravenous fluids with intravenous medications, and that's not the place to start the ketogenic diet. You're going to have to wait down the road for that to work. So again, I can't answer that in full, unfortunately.
Thank you for your input, though. In the book, The Mitochondriac Manifesto by R.D. Lee, he proposes that a ketogenic diet is the best course of action for depleting or lowering deuterium in the body, which is another substance which can decrease mitochondrial efficiency, energy production, and athletic performance. Do you have any thoughts on deuterium?
I'm kind of a very low-level doctor, not like Dominic. Need to ask him that. Sorry, I can't answer that.
Uh-oh, Mark's sneaking up to the mic.
That was awesome, Michael. Just curious, in your career, what's been the uptake in like the larger hospital systems, medical schools, VAs, to what you're doing and, your interpretations of a lot of the psychiatric disease? Do you feel we're kind of making forward progress, like with you and Chris Palmer, or do you feel we're stalled? You've been at this a long time.
We are making progress for sure, but it is a battle. And I learned from this conference that I have to bulk up sarcopenia, number one.
Yes.
But also to fight with my colleagues, because my biggest criticisms comes from dietitians and cardiologists. Absolutely. And I send patients away, and then they go to the cardiologist and say, "This is unbelievable. You can't follow this diet. Look what happened to Adkins. He died of a heart attack," which is not true. All that sort of thing. And it's going to take time. But I think the most effective mechanism for changing the world is through conferences like this, bringing all these people together, and we speak to each other, and each of us are now disciples, and we're going to go back to our communities and hit that message even harder all the time. Yeah, I speak to my colleagues all the time about it, and to have a whole long list of references and New York bestsellers book. I keep on referring to Nina Teicholz's book. I gave that to an endocrinologist chief to read, and it changed his life. He stopped his statins. He feels great. The cardiologist won't read it. Pardon?
Some of us will.
Nice.
Yeah, no. Most people I speak to, they get it. I've recently treated a physician with early onset dementia who failed hyperbaric oxygen therapy. He bought himself a keto meter. He's a new guy. He lost 80 pounds in 6 months. He feels completely different. And so we're all impacting people, and they, of course, spread the message themselves. So thanks again to Doug. I thought I had done something wrong just now, Doug. I don't know. But Doug, your conference is great. And, yesterday there was standing room, not even standing room available. And so I think this is the way to do it for sure.
No, thank you. Thank you for what you're doing.
I do have a couple more coming in online. Dan van der Riet is asking, could you go over your 5 rules for brain health?
Yeah, so I've worked in huge medical establishments for the last almost 40 years now, and especially with the stroke centers and traumatic brain injury. So that they tell you, when you discharge a patient, you will do a medicine reconciliation. You ask people, what are they taking, how much, and when? And you check their bag, make sure they're taking it and correctly. All right, so we have to do that by law, and it gets done. But what I'm doing now is I'm saying physical exercise is a vital sign. Not many people know that, but you must regard it as a vital sign. And so are the other 5 brain fitness rules, which are cognitive exercises for brain padding or cognitive reserve, socialization, powerful anti-inflammatory effects in our brain, nutrition, anti-inflammatory diet, and of course, sleep hygiene. I give people a brief handout, which takes 5 minutes to read. I give them a handout, which takes 25 minutes to read. And then I have 1 or 2 books that I've published on the matter. And if you want to do that, I give them a list of 30 books that they can choose from. And then I give them specific performance criteria that when I see them again in 2, 3 months or 6 months, we will measure your fitness age, for example, according to the Norwegian mechanism, or your body mass index, how many steps you take, your VO2 max. I ask them, which one do you prefer? And of course, the inflammatory markers, the body mass index, blood pressure, etc. We do all of that. I give them sleep scales. I give them socialization index scales. And I also measure their cognitive reserve. And I give them, every 6 months, I give them, or once a year, a computerized cognitive test called CNS Vital Signs. It takes about 40 minutes to do. It gives us all the major neuropsychological domains. So I measure their performance metrics whenever I see them. And the response is usually dramatic. But you've got to tailor it to what they want. Exercise needs to be tailored to what you enjoy doing. And sometimes with the spinal injury cases, the paratrooper with the 500 jumps, or I also treat a Top Gun type pilot, F-18 pilot, who's had 300 plus aircraft carrier landings, and he's injured his neck from doing this. Can you imagine going from 200 miles to nothing in 3 seconds? So he injured his neck. It's severe pain. So it depends who you are. And if you cannot exercise properly, throw them in the pool. Aquatherapy, pool therapy, whatever works for you. But there's always something you can do.
Good, thank you. Looks like one last question. We'll see if there's another come in. If we are designed to eat seafood, can you address the contamination of fish from ocean pollution and possible heavy metal toxicity?
Well, I mean, the two are not really related. They didn't used to have pollutants when we first ate seafood. And we have pollutants everywhere in our meat and the environment. For all of us who have lawns, we pollute them with things like Roundup and all sorts of other chemicals. So chemicals are ubiquitous in the environment. And yes, it is a problem in certain areas of the world. And you do have to be very, very picky about where you get your food from. Just something you have to watch out for. But the fact is that brain-specific nutrients can come entirely from seafood. And the second most important food, according to my readings, are eggs.